The IFM Spotlight session in the morning was a non-profit sponsored session, and actually the program of this session was fully centered around the results of the IFM 2009 DFCI trial. So we had the first interim results from the clinical standpoint, which I presented on behalf of Professor Attal, showing that in a randomized trial comparing transplant versus no transplant, patient received induction with lenalidomide, bortezomib, dexamethasone, either followed by transplant, then consolidation and maintenance, or no transplant, consolidation and maintenance with lenalidomide for 1 year. So the primary endpoint of this trial was achieved with the superiority of the transplant arm in showing a better PFS in favor of transplantation. Then during the same session, we had the results of some ancillary studies that were performed based on the patient from this trial. We had a talk about MRD and the value of MRD in the field of myeloma, and Professor Avel-Loiseau showed very nice data highlighting the correlation between the negativity of MRD and the outcome. The deeper the response is, the better it is in terms of outcome. We had Professor Harousseau, who addressed the results of the imaging techniques. The patient included in this trial underwent PET scan MRI. And then it was clear, for example, just to make it short, that PET scan is a very important tool to the follow-up of these patients, whether in the transplant or non-transplant arm, and PET scan negativity can also correlate with outcome.